Now this is the extrathoracic branch of the axillary artery. Now if you see the course of the axillary artery, this is the ulnar nerve, this is the radial nerve, this is the axillary nerve, this is the musculocutaneous nerve, this is the brachial plexus, this is the musculocutaneous nerve, and this is the median nerve. You can see this is the median, this one is the musculocutaneous, this one is the ulnar. You can see the course of the axillary artery. This is the axillary artery and this is the axillary vein, satellite vein. Now you can see the course of the axillary artery. You see it is going in the loop which is formed by this median nerve and musculocutaneous nerve. You can see this loop. This is the loop through which the axillary artery passes. This one is the musculocutaneous nerve, this one is the median nerve, this is the axillary artery. Now this loop is called ansa axillaris and it is present at the medial aspect of the shoulder joint. This is the scapula, this is the humerus, this is the shoulder joint, this is the medial aspect of the shoulder joint, and this is the loop, median nerve and musculocutaneous nerve. This is the ansa axillaris, and this is the coursing of the extrathoracic branch of the axillary artery through this loop. Now if you see, this one is the medial aspect of the shoulder joint, this one is the medial aspect of the shoulder joint, this is the, you can say, the brachial plexus, this is the brachial plexus, this is the axillary artery which is the extrathoracic branch of the axillary artery, and side by side the satellite extrathoracic branch of the axillary vein is also there. Now if you see the axillary artery, the first branch, the first extrathoracic branch of the axillary artery, you can see this one, this larger trunk. This larger trunk is the external thoracic artery. Now if you see the course, it will go downwards and supply to the, if I will keep like this is the extrathoracic artery. This one is the extrathoracic artery. This one. It will go and supply to the coracobrachialis, biceps brachii, and here there are presence of the pectoral muscles by coracobrachialis, biceps brachii, and pectoral muscles. The next branch is the opposite side branch. This one is the, you can see the external thoracic, and towards the opposite side you see very small branch, that is the suprascapular artery. Now if I will keep like this, you can see the supraspinatus muscle. So the suprascapular artery will supply to the supraspinatus muscle. Now after giving all these branches, the axillary artery is now known as the subscapular artery. This is the subscapular artery. This is the local branch of the subscapular artery. Finally the subscapular artery trifurcates, or you can say it gives three branches. You can see these three branches. This is the radial nerve which I am keeping aside. This one is the axillary nerve which I am keeping inside. So if you see this superficial branch, it is going towards the, this is the latissimus dorsi muscle, this is the teres major muscle, this is the latissimus dorsi. You can see the superficial branch is going towards the latissimus dorsi. This is known as the thoracodorsal artery, this one. And this one, you can see it is going towards this one. This is the circumflex artery of scapula. Now it is, you can see the course, it is going towards the proximal side. Now this is the three bundles of the subscapularis muscle, and this is the teres major muscle. So this circumflex artery of scapula, this one is supplying to the subscapularis muscle and teres major muscle. Now one of its branch, actually it passes through the nutrient foramen which is present at the caudal border and distal end of the scapula, known as nutrient artery of scapula. You can see, if you see the bone, this is the scapula. Now this is the cranial border, this is the caudal border. Now you can see towards the distal end the nutrient foramen. This is the nutrient foramen. This one is the nutrient foramen. Now another branch, you can see it is going downwards. if I will keep aside the radial nerve, keep aside, this is the circumflex artery of scapula, but I can see about this branch. You can see this branch. You can see which is going downwards, this one. This is the posterior circumflex humeral artery. Now from medial aspect it is going to the lateral aspect, and it will supply to the lateral aspect of the muscles of the lateral aspect of shoulder region. This is the deltoideus muscle, this is the infraspinatus muscle, and this is the, you can see, teres minor muscle. This is the teres minor. This one is the teres minor. So this posterior circumflex humeral artery, this one going to the, from the medial aspect to the lateral aspect of the shoulder region, and finally supplies to deltoideus, infraspinatus and teres minor muscles. Now after this trifurcation, giving this trifurcation, now the axillary artery enters into the, you can say, arm region and termed as the brachial artery. The first branch, this is the ulnar nerve, this is the combined musculocutaneous and median nerve, this is the proximal branch of the, you can say, musculocutaneous nerve, this is the coracobrachialis muscle, this is the biceps brachii muscle. Now if you see this first branch, this is the of the brachial artery, is the anterior circumflex humeral artery. Now you can see the course, it is going towards the coracobrachialis, and below that the biceps brachii muscles. Now at about the middle of the arm region, you can see, at about middle of the arm region you can see another branch. This branch is the deep brachial. This is the deep brachial artery. You can see where it is going. It is going towards the triceps. Now if you will go little bit distal or downwards, at the level of, you can say, this is the point of elbow, this is the olecranon process of ulna. At about the olecranon process of ulna, there are multiple branches. You can see, you can see the multiple branches. This one is the multiple branches. This one, multiple branches. This is the collateral ulnar artery. Now this collateral ulnar artery, it supplies to, you can see, the triceps, distal end of the coracobrachialis, biceps brachii, this one, and proximal end of flexor group of muscles of the forearm region. Proximal end of flexor group of muscles of the forearm region. Now if you go little bit more distal, at about the level of elbow joint, you can see, at about the level of elbow joint, you can find one small branch from the anterior aspect of the brachial artery. This one, anterior aspect of the brachial artery. This is the transverse cubital artery. This is the transverse cubital. Now it is supplying to the distal end of the biceps brachii. This is the transverse cubital artery. This one. This one is the transverse cubital artery. Now distal end of the biceps brachii muscle, and its further branches supplies to proximal aspect of the extensor group of muscles. It is going towards the lateral surface of the forearm. Proximal end of the extensor group of muscles. This is the pronator teres muscles, which I have reflected, and this is the flexor carpi, two parts of the flexor carpi radialis muscles, which I have also reflected. Now if I reflect the pronator teres and flexor carpi radialis muscle, this is flexor carpi ulnaris. This one is the flexor carpi ulnaris. So if I reflect both these muscles, I can find this is the, you can say, median nerve. This is the median nerve. So if I reflect the median nerve, I can find the branch. After giving the transverse cubital, the smaller branch, and the brachial artery now enters the region of the forearm. Now it is known as the median artery. This is the median artery. If I will take the median artery at the level of, you can say, proximal interosseous space between the radius and ulna, at the level of proximal interosseous space, you can see one branch, this branch. This branch, you can see this branch. This is the common interosseous artery. Now where it is going, you can see it is the anterior aspect. This one is the anterior aspect. This one is the posterior aspect of the forelimb. Now you can see where it is going. The common interosseous, it is going towards the posterior side. So it will continue up to the digit as lateral volar digital artery. This one, common interosseous, lateral volar digital artery. Now after giving this common interosseous, the median nerve continues downwards, and finally it divides into two terminal digital branches. Now two terminal digital branches. Now this branch which continues, this branch of the is the median artery. So the median artery, this one, this is the continuous branch, larger branch, which is coursing below the flexor carpi radialis muscle. This is flexor carpi radialis muscle. If I reflect the flexor carpi radialis muscle, and this is the pronator teres muscle, mostly the flexor carpi radialis muscle, if I will reflect, I can see the median artery. Now this, you can see the division. This is the larger division, this is the smaller division. This one is the smaller division. The larger division is known as the ulnar artery, and the smaller division is known as the radial artery. The ulnar artery is passing below this flexor carpi radialis muscle. Now see where it is going. It is going completely towards the posterior aspect of the limb and continues finally as the common volar digital artery. Common volar digital artery. And the smaller one, the radial one, this is the radius bone. You can see the location of the radial artery. It is present at the postero. You can see this one is the postero. This is the anterior side. This is the posterior side, and this is the medial side. Lower one is this one is the lateral side. So at the postero medial aspect, you can see postero and medial aspect of the radius. This is the radial artery. It continues downwards, and mainly it forms two important arteries. That is at the level of the you can say manus region, anterior aspect, it forms dorsal metacarpal artery, then continues downwards as the dorsal common digital artery. So three distal arteries of the forelimb. One is the radial, another one ulnar, this is radial, and another one is the common interosseous. This one is the common interosseous artery. This one is the common interosseous artery. Now all these arteries actually they take part in the formation of carpal rete. Rete means it is a network of blood vessels which controls the blood supply to the area in the manus region. So this is the carpal joint, this is the anterior aspect of the carpal joint, this is the posterior aspect of the carpal joint. So anterior carpal rete and posterior carpal rete are formed by contribution of all the three distal arteries of the forelimb, that is common interosseous, radial and ulnar.